Hello, my name is Kay. I am an early childhood educator working with toddlers from 6 weeks to 2 years old. Today, I wanted to share a story about a little boy. I'll call him Jacob. He is 2 years old and was recently diagnosed with autism. When Jacob first came into my classroom, I noticed something unique about him. His mom shared that during labor, the umbilical cord had been wrapped around his neck for a long time, which caused a loss of oxygen. Even with that challenge, Jacob showed incredible intelligence. He could count from 1 to 10. He recognized his colors, and he could identify many things around him. But something was different. He struggled to communicate his wants and feelings. Instead of using words, Jacob would grab my hand and pull me toward what he wanted. At first, I allowed him to communicate this way, but after some time, I wanted to see how far he could grow. When I encouraged him to try using words, he became frustrated. He even tried to use his head to hit me when he could not express himself. This continued for several days. So I tried a new strategy. I began giving him simple responsibilities, being the line leader, turning the lights off and on, picking up items he wanted. For a while it worked, but then Jacob discovered that if he threw himself on the floor and banged his head, adults would rush to him and give him extra attention. This was frightening to watch. I spoke with Mom again, and she told me his doctor explained that those behaviors were part of his autism. She also shared that he was diagnosed at level 1. That conversation motivated me to research more about autism spectrum disorder. Over the past 4 decades, autism spectrum disorder has become a growing public health concern in the United States. Many children with autism engage in aggressive or disruptive behavior towards themselves, peers, families, and teachers. These behaviors can become barriers to learning and can create safety concerns. If these behaviors are not addressed early, they may become a long-term pattern. That is when I learned about parent-child interaction therapy, also known as PCIT. PCIT is an evidence-based approach that helps reduce problem behaviors and strengthens positive interaction. That is when I learned about the parent-child interaction therapy, also known as PICT. It was developed by Dr. Sheila E. Bird in 1970. She created this approach to help children and their families, also caregivers, build a stronger relationship while also reducing challenging behaviors. PICT is mainly used for children between the ages of 2 and 7 who are struggling with behaviors such as aggression, temper tantrums, self-injuries, defiance, difficulty following directions. It is also used with children who have ADHD, tantrum histories, and children who have trouble regulating their emotions. The goal of PICT is to teach parents skills that help their children feel safe, supported, understood, while also learning to communicate, listen, and follow directions. Research consistently shows that PCTI is highly effective for children with ADHD and for families navigating challenging behaviors. Learning this therapy helped me better understand that early support can truly change a child's developmental path. There are two main parts of PCIT. The first one is child direct interaction. Parents learn how to connect, praise, and follow their child's lead. This builds trust, reduces frustration, and strengthens the child's bond. The second one is parent direct interaction. Parents learn how to give clear and effective commands and use a calm voice. Consistent, disciplined strategies. This helps reduce problem behaviors and increase positive behavior. At this time, as time went on, I observed more of Jacob's response to frustration. He began to scream, run around the classroom when he felt overwhelmed. When he became upset, he would throw objects, sometimes without warning. These behaviors affected learning time, safety, and the emotional comfort of the group. I knew these actions were not intentional behaviors. They were communication. Jacob was telling us in the only way he knew how that he needed help, understanding, and the tools to express himself. Instead of using words, Jacob would take my hand and pull me around the class, as I mentioned before. This continued. Like I said, it was very heartbreaking for the both of us. I realized that I needed to strengthen my belief in the importance of early intervention. Children like Jacob are not trying to be difficult. They are trying to be understood. It is also used with children who have autism spectrum disorder. The goal of PCIT is simple but powerful: to equip parents with tools that help their children feel safe, supported, understood, while learning how to communicate, listen, and follow directions. The end.